Hello students, so today we'll be talking about fitness assessment. This is the second part of chapter 2. Hopefully this is a refresher for you from taking measurement and evaluation. Maybe you're taking that course right now. We will talk about fitness assessments that are used for the general population, and then we'll discuss the reasons why there needs to be some modifications to those fitness assessments when we're working with special populations. And throughout the course we will be discussing what may be appropriate substitutions for given a certain special population. So rationale for and benefits of testing. First of all, it's really important to establish a baseline to track progress. You want to know where your clients are starting from. That way you can gauge if progress has been made, if they have made improvements. That can also serve as a motivating factor for your participants and clients when they see that they're actually improving. Also identifying current levels of fitness that will contribute to the exercise program. So you will use their current level to determine what exercises to include and what exercises perhaps to leave out. Establishing appropriate exercise selection, frequency of exercise, intensity of exercise, and volume of exercise. So by knowing where your client is at, also classifying whether they're beginners and intermediate or advanced participants will determine where you begin, and you will use the exercise principles of overload and progression to prescribe your exercise programs for your clients. As always with everything, it will help you to set achievable short-term, medium, and long-term fitness goals that will serve to motivate your clients towards success. You can also use it for identification of a client's needs and limitations before exercise program initiation, and establishing a method of recording decisions regarding appropriate scope of practice in case the client experiences an injury or an exacerbation of a current medical or health condition after that program begins. So it's a good way of keeping track of everything that you're doing with your client and covering your butt. So assessment goals and standards. Fitness testing results must be put into context in order to provide guidance for goal setting and progression. Properly standardized tests will yield results that can allow clients to be compared either to their peers using a percentile rank, which is norm referenced, or some established standard for health criterion referenced. Regardless of the standard used, clients can still track their improvement by comparing later scores to initial scores, improving self-confidence and motivation. This is important since standards for disease or disabled individuals are lacking, and often reaching preset goals is the only source of tracking progress. When testing special populations, it is really important to select appropriate fitness tests, and it is the exercise professional's job to recognize how a given condition may require the alteration of the standard assessment. So in this course, this is what we will be doing throughout the semester. We will, after determining physiological differences, what the pathology of the client may be, if they have any movement restrictions, so we will select fitness tests that will be better matched to that client's current condition. Additionally, a client's maturity level and chronological age may also affect her test performance. So certain protocols may be more appropriate for younger clients but improper for older ones. So children, for example, have a specific battery of tests that are often used that are more appropriate and maybe are more fun for children, so they're being more motivated to participate. And certainly for older adults that may have other conditions, may have movement restrictions, many of the tests that are usually used for general populations will not be appropriate for them. And we also have different tests, sometimes based on gender, different protocols, so we have to be careful when we select those. Fitness assessment. So what is the purpose? So if I were to sum it up, what is the purpose of testing? So the purpose is, again, to establish a baseline, to find out about your client, to determine which path you're going to take, what may be better suited to yield to improvements on the components of fitness and yield to improvements on perhaps some of the skill components of fitness. And then you have to think about what tests you select. You want to select tests that are valid and reliable. Validity means that, for example, a scale is a valid test for measuring weight, but it's not a valid test for calculating body fatness or circumference or overall health. It is just a test for weight. So it's a valid test. A scale is a valid test for assessing somebody's weight. Reliability means, going back to the same scale, how often do you get the same result? So if you step on a scale and one time you're 130, the next time you step again and you're 135 on the same day, and then you're 125, then that scale is not very reliable. So perhaps it needs to be calibrated, right? So you want a test that is both valid and reliable, and reliably right, because you could also have a scale that is reliably wrong, that is always 5 pounds less. So it is important to make sure that when we conduct tests, that we do everything that we know to make sure the test is repeated in the same way, in the same manner, each and every time, so that we can compare from one time of testing to the next time of testing. So that's very, very important. We have to select tests that are being careful about age that the tests were made for. There's some gender-specific protocols for testing. How much for some tests they need to have some level of understanding of the movements. For example, the 1 repetition bench press test requires knowledge of how to bench press. We have to take into account the environment, whether that's going to affect your testing. And certainly some tests are more expensive than others, so sometimes we have to select tests not so much because maybe the best test, but because it's the one that requires the least amount of equipment or cost. Other things to consider, tests can affect each other, so the testing order is going to be important. We want to make sure that from testing situation to the next, that we have consistent environment. So let's say you're working with athletes and you're testing them outside in August, and you're doing all your testing in August when it's humid and there's no wind and there's a lot of sun exposure. So you get one result in August, and then you decide to retest again in December when there's more mild temperatures, and then your athletes perform a lot better. So it would be difficult to make the claim that your athletes have improved and that the environment had nothing to do with it. It's possible that they did improve, but considering the changes in the environment, it would be difficult to make that claim. The client's current health status has an impact on testing as well. If they're experiencing some kind of illness or they have a disease condition that is going to affect the testing until that's resolved, that's going to be something to consider. And before starting your test, you need to have everything laid out, decide exactly which protocols you will use for which test. Make sure you have a way of recording all of your results immediately, that you're not trying to remember what they scored on certain things, because the likelihood for errors is increased when you do that. And always making sure that the environment for testing it is safe. All of that is going to be important to consider before even deciding on or beginning your test. Here's an example of a possible, this is from the NSCA personal training text, an example of what your recording sheet may look like. Certainly you may tweak it depending on what test you actually will use, but this will help you to keep it all together in one sheet. So client information, maybe you want to put the goals, anything from the screening that we talked about last that you think it may be important. You want to put it there so it's ready for you to see, so you don't have to remember it. And so any other comments, any other previous assessment dates, anything that you think is relevant to testing. You start off with your vital signs, resting blood pressure, resting heart rate. You can also do height and weight, and you have to take those. You take the height and weight. You don't ask your clients those things. We'll talk more about how to do it appropriately or correctly. Then after having height and weight, you can calculate the BMI, and you can go ahead and write down the classification. You could do waist circumference only, or you could do waist hip circumference and do that waist to hip ratio. We'll talk more about what that may mean, although now waist circumference is significant. And if you have a body fat tests that you are going to use, then you would do that there. So all of those tests are not fatiguing tests. Don't interfere with anything else. You would want to do, you could do this early. You certainly wouldn't want to do body fat testing after all the other physical tests, because that could have an impact on body fat results. Although cardiorespiratory endurance is placed here, you would actually want to do that later on. You want to do that after muscular strength and muscular endurance. Flexibility you can certainly do last after you're warmed up, or you want to, if you're going to do it early, like before your other tests, you want to still provide a warm up and then try the flexibility assessments. And then any other tests, we're going to talk about some other tests that may be appropriate. Maybe you're working with an older adult and you have certain specific tests that you want to do on movement. And so those would be added there. But this is an example. And so you want to have this all laid out so it's an easy way to document the data, to keep it from assessment to assessment, so that you can compare and see if the client's making progress or if you need to reevaluate. So as I was saying, testing order. So testing order is important. If you want to do the non-fatiguing test first. If you're doing any type of agility, that would be next. Agility is not very stressful. Thinking here, the T-test, the Pro Agility, or any other modified agility test, you could put those here. Muscular strength test would be next, then muscular endurance, then cardiovascular endurance test last. If you are doing, if you're working with more advanced individuals who are doing more skill testing, you could do like the 400-meter test right after muscular endurance. You could do, or the 300-yard shuttle run for football, you could do that then. And then ideally, you wouldn't do the cardiovascular endurance test until maybe even a later date, because after doing those fatiguing tests, you would not want to do anything else. So all that is to consider is just a general battery of tests that you may have for the populations that you may work with. And testing order is certainly very, very important. So as far as things you will do before you actually begin the physical activity, if you want to think of it that way, we call these pre-assessment measurements, so that are non-fatiguing tests. Taking resting heart rate, and you would do it yourself, resting blood pressure, body weight. For height, for body weight, again, you wouldn't ask them. You would actually make sure they empty their pockets out. If they have jackets, they can take that off, and shoes, and make sure that next time that you weigh them, you do it the same way, so that that's consistent. Then height, you would again want to measure them. If you have a stadiometer, that's with the little bars that come on top of the head. Those are the most accurate, but they may be a little bit more expensive. If that's not available, then you can have the client go up against the wall, back to the wall, feet all the way down. Make sure the heels are down, they're standing up tall. Make sure the nose is parallel to the floor, so they're not tipping their head up or down. And then use either a ruler or a clipboard, something that's a straight edge, and draw a line and then measure that height. They also have, you can also purchase tape measures that go right on the wall, and you can do it that way as well. But it's important that you measure the height each time. As we talk about older adults, we also know that as we get older, height may actually decrease. So keeping tabs on that is going to be an important factor. And if you're working with certain populations, but perhaps with more with higher needs, you may also take lung function before activity every now and then. And so doing that would also, and we'll talk about how to do that, maybe one of the things that you will do with some clients. And so resting heart rate, how to do that, you want to make sure that you do it yourself. You're going to use 2 fingers, ideal on the radial is the most convenient. You want to make sure you tell the client what you're doing, and then you measure it for a whole minute. You start with 0 and you measure for a whole minute. The brachial artery you can also feel it there, but that one is one that we will palpate for blood pressure. We wouldn't use that for resting heart rate. Same goes for the temporal artery. You can actually feel it there, but you wouldn't actually take it there. If you have a stethoscope, you can also try to listen for it. You can actually place it on by the sternum, left of the sternum, and listen to the heart rate that way if you prefer. And you can also use heart rate monitors if you like as well. So that's the easy way of calculating resting heart rate, but you will take it for a whole minute and document that number. As the client becomes in better shape, the fitness level improves, and the heart muscle improves, we will see resting heart rate decrease. So that is a simple way to see progress on or improvements on cardiovascular function. Here's some of the norms for resting heart rate. Certainly we don't need you to remember this, but you can see some distinctions based on age. So as we get older, our heart rate does go up a little bit. And there's differences between males and females. So females will have a higher heart rate than males, simply because they're smaller. So the circuit happens sooner. So you can see some distinctions in that as we look at the differences between genders and age. So blood pressure as shown in the picture, manually taking with a sphygmomanometer, which is the dial thingy, and the cuff, which there's different cuffs based on size. So they make an extra large one for people that have larger size arms, and they make a little smaller one for people that have smaller arms. So you want to make sure you use the appropriate cuff. There's one for children as well. It needs to be used if you're working with children. And then you need a really good stethoscope to be able to listen. Sometimes you can't listen because the little microphone, the stethoscope, is not so good. So you want to make sure you have a good one. It is an indirect measurement of the amount of force that blood exerts against the arterial wall. So it is a good screen for determining overall health of the arterial system. And it's not very difficult to master. So as far as how do you measure blood pressure, ideally, again, you've warned the clients in advance to are going to be tested to not have drank too much or smoked too much or caffeine, because that could interfere with it before exercise. So when they come in, maybe you're talking to them for a while, you make sure their feet are flat, because if your legs are crossed, you may be pinching some of the blood return. And then you apply the cuff, just 1 inch from the elbow crease, and so you have space to put the stethoscope, and then you inflate the cuff. If you know their blood pressure, what that is, you want to go above that. So if you don't know, then you would go about 160, inflate it rather quickly, so that I don't have the discomfort of basically you're cutting off the circulation from the top of the arm to the bottom, so it's not very comfortable. And then you find the brachial artery to put the stethoscope. So then you deflate the cuff, about 2 to 3 milligrams of mercury per second, and it kind of looks like the second hand of a clock. So you want to see it, and then when you record, when you hear the first sound of the blood coming from one side to another, that's going to be your systolic. And when you stop hearing it, when the pressure from both sides of the cuff balance each other out, then we're not going to hear any sound. That would be your diastolic. If you need to measure again, you want to wait a minute before doing so on the same arm. As far as the classification of blood pressure, normal should be less than 120 and less than 80. Pre-hypertension is between 120 to 139 or 82 and 89, and this has changed in the last few years, trying to detect it earlier so that it can be addressed earlier, because the longer you have high blood pressure, the more damage that causes to the arterial walls. So depending on risk factors, doctors will either do just diet and exercise, or they will recommend medications. So it depends on other factors and the stage as well. Right. So as far as assessing lung function, and not something you will do with everyone, but the point here is to see the forced expiratory volume. And if you click on this video here, you will be able to see how to do it. You want to use a nose clip to make sure that they're not trying to breathe out through the nose, because they're going to take inhale as much in as they can, maximal inhalation, try to bring in as much air as they can, and then they're going to try to exhale as much air as they can into the spirometer. And that will give you a measure of how they're doing in their forced expired volume. And this forced expired volume is something that we're going to talk about when we talk about respiratory diseases. So it's going to be an important skill. So if you're working with anybody with respiratory diseases, you will be involved in doing that with them. So common fitness tests that you may use or may want to incorporate into your battery of tests. There's various body composition tests that you can use, and also anthropometric measurements that you can take. Certainly have muscular strength tests. There's muscular endurance tests, cardiovascular endurance tests, flexibility tests, and maybe some that you haven't thought about, but maybe you've seen in physical therapy. There's neuromuscular assessments that can be done, functional performance tests, and then other specific assessments that may be used given a certain special population. So you have some decisions to make once you've completed the screening and the health history. You have some decisions to make about which fitness test may be appropriate for this one client. So as far as body composition, what do you have available? Something as simple as a body mass index, but as we should understand, body mass index is just a screen for body fatness. It doesn't necessarily tell you if what percentage of body fat they may have. So it gives you different categories, and in this category we have up to the normal, overweight, and the obese. There's also, for the obese, there's two other stages. So it could be 30 to 34.9. It could be just the stage 1. It could be, or class 1, it could be class 2, 35 to 39.9, and then over 40 being what used to be called morbidly obese, which is the most serious type of obesity that usually lends itself to pharmacology treatment and maybe bariatric surgery. You could also use the waist to hip ratio. Explanation of the protocol on page 43, but you take the smallest waist circumference and the largest hip circumference with your feet together. So you go around your hips and see which is the largest, and then you get a ratio of waist to hips. For women, anything in the 70s is pretty good. And it's dependent on age, but it's usually in the 70s is good. And it's going to be considered high if it's in the 80s for women, and men it's considered if it's in the 80s and 90s, and considered a risk factor for heart disease. Now we know really that it's not so much the ratio. For example, you're going to have someone that is broad on the hips and on the waist, so there's not a big distinction. But if they have a large waist circumference, and men over 40 inches and women over 35 inches, that's actually the health concern. So lately we are just doing more with just waist circumference as opposed to the ratio. And then body fatness. And there's different tests for body fatness, but too much body fat is going in relationship to the rest of the body composition is what's the health risk. You could also test it through bioelectrical impedance. That's the body fat scale. Ideally is the scale that takes your weight in time, and then it sends a current through the body looking for body water. So the more body water you have, the more muscle you have, because muscle is composed mostly more with water, and fat has very little. So if you have more muscle, you're gonna have more water. So that's what the test is checking out for. So just based on that, you know that if you're dehydrated, if you try to do the body fat scale after exercise, early in the morning, before eating anything, then you're gonna appear to have a higher amount of body fat than what you do have, so it could be thrown off. So bioelectrical impedance is most accurate if it's done middle of the day, same time every day, and then you can sort of keep track of it for maybe a couple of weeks, and just over time you can see some changes over time if you're consistent with how you do it. But if you do it like on a Monday at 3 and then you decide to do it on a Friday at 6 a.m., you can't compare those two results because your body water fluctuates daily. So here we see the body mass index chart. This is one that doctors will use to make it easy. So they look at your height in inches, and then they scroll over to your weight, and then they can see, for example, if you're 66 inches tall, you scroll over to your weight at 155, so you can see that the BMI for you would be 25, which is considered slightly overweight. So it's an easy way to calculate it without having to do the actual math, which is weight in kilograms divided by your height in meters squared. So as far as skin fold procedure to determine body fatness, you're gonna pinch skin and fat as shown on the picture. So if you were to pinch the back of your arm, your tricep, try that. Just like in the picture on the bottom right. Pinch and then tighten your tricep. Tighten as much as you can. You can see that some of the fold that you had left, that's because you had some of the muscle in there. Now relax. Now you can say that you have the skin and the fat. From the skin fold measurements, what we're doing is the thicker the fold, the more body fat you have subcutaneously. The smaller the fold, like for example, take the top of your hand, the smaller the fold, the less body fat you have. So it's a pretty simple procedure that gives us an indirect measure of body fatness that we can use to see if there's changes over time. So first you want to identify and mark areas that are going to be measured, just like shown in the picture with an X. So start from the top and work your way to the bottom. Mark every area based on the instructions on how to find the correct location, so that next time you do it exactly the same way and you have valid and reliable results. So you go from the top to the bottom one time, top to the bottom another time. If there's differences, then you may have to reassess. So you're going to grasp a fold of skin with thumb and index finger on the left hand. You're going to maintain that that pinch with your hands. Then you bring the calipers in with the other hand, just slightly below, like the picture shows, about 1 centimeter below where your fingers are. You're keeping the pinch as you bring the calipers in. You are going to be doing this rather quickly. You want to read quickly because otherwise it will pinch, it will go further in and it was going to throw off your results. So you want to record readings on calipers within 1 to 2 seconds and measuring to the nearest 0.5. And you have to also remember before you have to release the calipers before you bring it out. Otherwise you're going to hurt your client pulling it out. And then you're going to retest again one more time, so starting again from top to bottom. And if they're off more than 10%, which is about 1 to 2 millimeters, so let's say you get 13 millimeters in one and then you get 17 in another, you have to redo it again a third time, and you would use the average of the closest two measures. That is how you do it. You can also, to learn more about how to do this correctly, I'd really like the website Exercise RX. If you follow that link, it will tell you how to do it. I'm going to show you some of the calculations, but they actually have a program there that does all the calculations for you. All you do is input how many millimeters you've got on each of the sites. And there's 7 sites that you would use for this. So skin fold sites for body composition, you have the triceps, which is the one that was shown on the last picture, is a vertical fold. Mid-axillary, which is the midline of the body at the level of the xiphoid process, is a vertical fold as well. It's on the side underneath the arm. The chest, differences between men and women, so they're gender specific. Women are 1/3 of the way, men are half of the distance between the axillary line to the nipple line. Then the subscapular in the back is diagonal fold below scapular angle, like right underneath where the pointy part of the scapula in the back. The suprailium is a diagonal on top of the iliac crest, superior to the angle of the iliac crest, and is also diagonal. And the abdominal fold is about 2 centimeters on the right side. By the way, all these measures are taken on the right side of the body, and this one will be on the right side of the belly button. And on the thigh, you're going to go right as a vertical fold is the anterior midline of the thigh, midpoint from the patella and the hip. So you sometimes having them raise their knee up, and then right where it creases, that's where you, right where the hip is, that's where you start your measure, all the way to the midpoint of the patella. And midway is an anterior in the front side of the thigh, and then you would do a vertical fold there. Again, if you follow the Exercise RX site, it will explain more in detail how to do that. And so that leads us to how to do all our math. And again, nowadays you can have an app that does it, you can do it on Excel. But first you have to take all your skinfold measurements, and here you show trial 1, try 2, and then the retest if needed, and then what value you're going to use. And so you could, in millimeters, so you have the tricep, the axillary chest, all of them laid out. You're going to sum them all up. They do have to be squared, so then all those values have to be squared. So then here you can do it right there, and then you're going to use those calculations. So the first step is to calculate body density. The next step, either using a series or the Brosick equation, is to figure out body fat. So body density is how much water will you displace if you were in a tank of water. Somebody who's more solid and occupies less space, they're going to displace less water. So that's an important concept. And then you compare to the norms based on age and gender. They are age and gender specific. Okay, so here's some of the equations variations on the equations that you may have to use depending on your client. If they're black or Hispanic, there's one, black men or male athletes, female athletes, white or anorexic women, white men, so there's differences. So you want to make sure that you use the right formula depending on your client. So no, there is some differences to be more specific. And so here are the percent body fat standards for adults, children, and physically active adults. And so not something that you just want to memorize, but remember that males will have less body fatness than women. Remember that gender, that as you age, you will have a higher amount of body fat, simply because one of the aging factors is that you're going to be losing lean body mass as you age. So if you lose muscle, and the composition from muscle to body fatness is going to have a greater amount of body fat as a result of the loss of lean body mass of muscle, as that happens with aging. So those are things that you want to remember as far as distinctions between the genders and the ages. Muscular strength test. So muscular strength is defined as a force that a muscle or muscle group can exert in a single maximal effort. So how much force can you exert as you recruit all of the muscle that you have available to be recruited, so a max effort. So this does take a little bit of motivation, so you do want people that are motivated to try it and not just going to give up, to really get an accurate record. Well, again, they also have to be able to maintain proper form when doing it. It is used to assess things such as maximum force, smoothness of contraction and relaxation, so they have no spasticity, the balance between the extensors and the flexor muscles. Sometimes that may lead to some injuries, and so that's or pain, so that may be some of the factors that you're trying to address. Symmetry between the left and the right sides of the body, and then how resistant they may be to fatigue. So as far as the tests that are used, the 1RM testing is the gold standard. Bench press, you can also do back squat, and it's done the same way. There's also done on the universal leg press, which is a specific type of equipment. Looks a certain way, not readily available much anymore, but it does offer the same standard. So usually for 1RM testing, you're going to be looking at your strength to mass ratio. So however much you can lift is depending on how much you actually weigh. Those that weigh more can certainly push more weight than those that are smaller. So total weight. So that's something to consider. You can also, as far as it's a little bit more expensive because you have to purchase the equipment, but the hand grip test is shown in the picture, the dynamometer, can also be used. That gives you a relative easy test to figure out muscular strength in clients without having to actually do an exercise such as the bench press or the back squat or the leg press. So that could be an option. They also sell other tensiometers that you can use for other joints, like there's one for bicep curls, and so there's some variations, but again, those are a little bit more expensive. So guidelines for the one arm testing, first thing is that they have to know how to do the exercise. So if you have to teach them how to do it, then that's out. You can't do it. They have to be warmed up, so that's also part of it. So this is the time, if you haven't done the warm-up yet, let's say you did all of the non-fatiguing tests. So before starting your actual physical test, this is the time to have begun your warm-up. So now you're moving on to the one arm testing and you're warmed up. But then they also have to warm up in the actual exercise. So part of the test is actually doing a light weight of the bar, of the bench press, before actually attempting to do the one arm. Same for if you're doing the squat exercise, and they may, once they try the one RM, they may also use an exercise belt for attempting the one. Here's a NSCA guidelines for the one RM testing protocol. Again, make sure that the client has time to warm up with easy light resistance, where they can do 5 to 10 repetitions, and they can do more than 5 to they can do more than 10, and just sort of getting the body ready for it. And then you provide a 1 minute rest period, so the intensity wasn't that high. Then at this time we're going to estimate a warm-up load that would allow them to complete 3 to 5 repetitions. So maybe add 10 to 20 pounds, or a 5 to 10% for the upper body exercise, and more for the squat exercise. Then now you give them a 2 minute rest period, and again you do the same thing. Then you estimate a conservative near maximal load that would allow the athlete to complete 2 to 3 repetitions. So by adding 10 to 20 pounds for the bench press, or 30 to 40 for the lower body. Sometimes if they already are familiar with the bench press, you can ask them how much weight do you do on the bench press and how many reps do you do, and so they'll tell you, and you can backtrack and figure out what may possibly be their 1 RM. And there's actually tables that will help you to predict their 1 RM based on how many reps they do when they're working. So they tell they do 10 reps of 225, you can predict that maybe they'll do 275 for the 1 RM if you already know what their working weights are. Sometimes that helps to expedite the process of figuring out. So because here you're just repeating. Once they're ready to try it, they're going to try the max lift. Then you want to try to get it in 5 attempts, no more than that, because then you're going to deal with a client being fatigued. Ideally 3 to 5 testing sets is what you want. And it's done when they can do it 1 time and not 2. It's when they can when they can press at 225 and re-rack in 1 attempt. That, and then the next one, if the next one fails, then you know that you had it on the last one. But it's really important, again, that the individual is motivated to try it. Now again, think about grandma trying to do this, right? So right there, you know that you're going to have to find an alternative for someone that has never done a 1 repetition max. As far as how it's calculated, body weight to strength strength ratio, it is how many times your body weight. So you can see that for men, for the bench press, excellent would be 1.48, almost 1.5 times your body weight. For women, if they can just do half their body weight, is excellent. Or it's not excellent, but 90th percentile. So if they can do that, that's what we're looking for. So 1.5 times for men, and then half for women is considered excellent. Muscular endurance test. There's a whole slew of different tests you can use. Your textbook talks just about one of them, but it's the ability of muscles to perform repeated submaximal contractions. There's push-up tests, pull-up tests, certainly different variations on sit-up testing that are used to determine muscular endurance for individuals. Your textbook talks about the partial curl-up test in page 228. So let's go ahead and discuss that one. It's actually could be very challenging for some of the special populations that we're going to talk about. But so you can also use a variation of the push-up test as well. And there's the YMCA bench press that requires moving, so you're not bench pressing to max, but you have a already set weight on the bar, and you just have to keep up with the metronome and move it to cadence in a certain amount of time. So bend knee curl up. This one is the one that's in your textbook. It does require a metronome. It's a muscular endurance test. You do want to have a padded floor mat and some way of recording it. You're going to have the client lay down on the mat, knees bend 90 degrees. You're going to see where their hands fall as they're laying down flat on the mat. So you place the tape where their longest finger is, and then you're going to put another tape 10 centimeters apart from that tape for all clients, all ages, all genders. So there's no variations here. It's the same test for everyone. They should already be warmed up, of course. You will also explain the test and what to do. They actually have to get, just like the client is doing on the picture, they have to get their fingers to touch the second tape. So many clients cannot even do it one time. They cannot lift up high enough, those 10 centimeters high enough to do it one time. So the metronome starts at 50. Once they've done 25, that's excellent, so you can stop the test. If they can't keep up with the metronome, so if they barely do one and the metronome, then that's it. It's because of the stress this could cause to the low back, and they're not allowed to rest. So although it doesn't look like it's challenging, I would like you to try that at home. You can actually do a metronome app, and you can see that it's not as easy as it may look initially. So for many people, this is not a doable test. Here are some of the norms again. So 25 is good, and so there's some variations based on age, certainly. So as far as cardiovascular endurance tests, and again, these are the ones. This is probably this one. If depending on what other test you're doing, this would be the last test that you do. Sometimes for some clients, maybe you're going to do this on a different day because it requires for some that much. But cardiovascular endurance test is looking to see the VO2 max. It's the way to commonly assess. It's usually assessed with a graded exercise test. But graded exercise testing, it's a little bit more expensive. You do need special equipment because the treadmills do have to have a grade increase greater than what you may find on your regular gym treadmills. So it is sometimes expensive. If you want to do expired air, you also need more equipment. If you're going to do, to get the accurate result, you also may need an EKG read. So it does take a lot more cost. But and for some clients, they can only reach what's called VO2 max peak because their limbs may have, due to symptoms of the disease, may limit their ability to do the activity. And so for many of the folks we're going to talk about in this semester, we cannot adequately assess using the common protocols such as the Bruce protocol on a treadmill. It has very large jumps in intensity, and many times just even the first stage is too intense for these folks. So more individualized, what's called a RAM protocol, and it's usually preferred. And we'll discuss those in a little bit. So what is the VO2? What is the meaning of the VO2 results? Volume VO2 is the amount of oxygen that your body can utilize maximum. We're talking about max VO2 that your body can actually utilize at the tissue level. So when you inhale and you bring in oxygen, not all of that oxygen that is coming into the blood will be utilized by the tissues of the body. You need the ability to be able to utilize. If someone is in better cardiovascular shape, can actually utilize more of that oxygen, meaning that they can maintain their aerobic oxidative state longer than someone who cannot. So it helps with everyday life. The higher your VO2 is, then the lower it is. So it indicates the max intensity that an individual is able to exercise. So let's suppose we have LeBron's Bruce protocol test, and it reveals that his VO2 max is 56 milliliters of oxygen per kilogram of body weight per minute. So what does that mean? So we know that at rest, this is true for all of us, we utilize 3.5 milliliters. So right now, as you're sitting here listening to me speak, you're at rest, I'm supposing, and you're utilizing 3.5 milliliters of oxygen per kilogram of body weight per minute. So you take your body weight in kilograms and you multiply by 3.5. That's how much oxygen you utilize per minute. So in this case, we have that we took LeBron to max, and max is where that's all you can do. We start to see that that is not going up anymore, and it's maybe the point where he just stops the test, either falls off the treadmill, or the test stops, and he gets to 56. So what does that mean? What does that mean as far as what med value may LeBron may be able to exercise at? How many times resting level? So this is a gauge of intensity. So we can look at, he did 56, so if we divide 56 by 3.5, we see that his max med value is 16 meds. So if we want to push LeBron to what he may be able to do, we may go to, we could maybe do running 9 miles per hour, and he could maybe do a 6-minute mile, 6 minutes, or we could do outdoor cycling greater than 20 miles per hour, right? Or we could do running maybe 10 miles per hour. So it's something in that category, something that he has the ability to train for or do, right? So med values are very helpful in determining, figuring out VO2 is very helpful in determining intensity for someone. Where are they at and where can we go to next? A VO2 of 56, VO2 max of 56 is rather good. That's very good. So that means that getting through everyday life is a lot easier for someone that has that kind of VO2 max. When we think about athletes, we'll take a look, but Lance Armstrong in his heyday when he was doing all the stuff, granted maybe he was doing other stuff too, but he was in the 90s, high 90s, and so pretty much any activity of daily living he could do oxidatively, and it was rather not so challenging. So for our participants, the more that we can improve their VO2, the easier everyday task will become for them. So here's a comparison of training status and VO2 max relationships. So our goals may be for someone that we're working at, maybe a special population, maybe to get them to the 30s if we can, because that means again that getting through everyday life without shortness of breath or and without being difficult is going to be a lot better. So we improve their functional capacity. You can see that for some of the highest elite athletes in the 90s and 80s, respectively, males and females. And so improving upon that, even for someone that has disease conditions, is going to improve their overall outcomes in life. As far as testing, we want to make sure that once we're doing the test, that the participant is aware of when we're going to stop the test. They can stop when they want to, but we're also looking for things of chest pain. They need to stop. We're going to be monitoring blood pressure, so if we any drop is an indication that the heart is not doing what it needs to, because blood pressure should be going up. And so we're going to look for any of these things that indicate that the person may be struggling and may be in serious risk. And so that would be an indication to stop the test. So what tests do we have available as far as cardiovascular endurance tests? And I have here again different kinds of treadmill tests. The YMCA step test demonstrated here, which is the platform and 4 risers. You can also use the recumbent stepper. This is a test for that. There's a cycle ergometer test. You need a specific bicycle for that. And the arm ergometer test. Think about disabled, wheelchair-bound clients. How else are you going to test them? So you're going to need somewhere to do it with the upper body. So there is an arm ergometer test that you can utilize to calculate VO2 max. So the treadmill test, if you click on the Bruce treadmill test here, it would actually show you a video of how the test goes. It does begin at a very slow speed, but it's already very steep. It starts at 10% grade. So most individuals that are older adults that may be deconditioned, that perhaps have neuropathy, which is one of the side effects of diabetes, where they have peripheral artery disease, where they get leg pain, they're not going to be able to even start stage 1 because it would be too difficult for them. I've had clients with peripheral artery disease that in the treadmill to train, they are doing less than 1 mile per hour. So this test would not be a possibility for them at all. so I would have to find something else. There is the bulk wear treadmill test. Does begin at a faster speed, but at 0 grade. So that may be an option for some clients. The speed does not change again during the test. So maybe that's something that they can think about. At the beginning of the second minute, the grade then is set to 2, and then it increases by 1%. So there's actually constant speed and small changes in the grade. But again, this test could also be very, very challenging for some. So as far as how do you calculate VO2 max, there's formulas for that. If you're going to estimate the max, so in these tests, you're going to estimate the max from the duration. How much time were they able to spend on the exercise? And so there's equations that you can actually use on your textbook on table 2.4 or here. So here in this table, you can see that depending on your client, whether men or women or elderly, you use a different formula. You plot in how much time they spend on the test, and then it will give you an estimation of VO2 max for those individuals. More of a cheaper test, the YMCA step test, was developed by the YMCA and researched by the YMCA, and it doesn't require a lot of space. It's simple in the sense that all you need is a step that many gyms have. I'm not so sure anymore that they have these steps, but they're available. You need the platform, which is 4 inches, and then 4 risers, so it's rather steep. So another limitation for some clients who may have knee issues or hip issues that cannot step that high. It is the same for both men and women, so the same metronome speed of 96. It is done for 3 minutes, and you do have to teach it and everything, make sure they can step up and down. So sometimes that's a limitation. You start the test and they can't even step at 96 beats per minute. So then you can't do that test. You may have to do a variation of it, and you have to document how you varied the test, but you can't compare it to the norms. This test, though, will not give you a VO2 max prediction. It only gives you a norm reference. What this test is looking for, let's look at the next table on the next slide. So here you see the test. So those are heart rates. So after the test, the 3-minute step test is over, you have the clients sit down and you take their resting heart rate. You take their heart rate, and so for those individuals that are well conditioned, what would you expect the heart rate to do? So if you're well conditioned, will your heart rate recover back to resting level sooner, or will it take longer? So if you thought sooner, faster, you were correct. So someone who's in excellent cardiovascular shape, they'll do the 3-minute step test at that cadence. You have them sit down, and if you look at an 18-year-old male, their resting heart rates are like back to 70, 78 at the beginning. At the recovery heart rate. So that means that the heart is so awesome that it can recover very quickly. And for those who are deconditioned, if you look at the very poor category, after 1 minute, they're still in what some of us would consider moderate to vigorous exercise. So it doesn't recover because it's not efficient enough to be able to do so. So, and because they're so deconditioned, right? So that's what this test does. So it's based on recovery heart rate, but it doesn't tell you their VO2 max at all. It doesn't predict that at all. So next, now you're nice and warmed up, right? You've done all these tests. So then maybe the test to do next is how I prefer the order. Maybe a flexibility test. And it can be the sit and reach box, which is you just have to move a little slider down, and you inhale and then you exhale and move the slider down. Or the sit and reach tape, which as you can see is a lot cheaper. I'm not crazy about what she's doing. You want the feet sort of be up to and the heels right on the tape, but hey, and you put one hand on top of the other, you inhale, and on the exhale you go forward and you get attempts. So let's take a look at that. This is the YMCA sit and reach trunk flexion test. You do need a yardstick or some other kind of tape measure. They do need to be warmed up. You may want to stretch the hamstrings first, and try the test out first. It shouldn't have any jerky movements. You take a deep inhale, and on the exhale, drop the head and reach and hold, so that you can count it. So you shouldn't bounce into it. The tape is initial tape is placed at 15. That's the mark 0, and so then you count how far past the 15 they go. Make sure their knees are straight, and they don't try to bend the knees. And then you measure to the nearest 1/2 or 1/4 millimeter, 5 millimeters, and the score is the best of 3 trials, not the average, but the best. You get 3 chances to get a higher score. So as you think about all these tests, you're probably thinking, or maybe not, be thinking, well, some of these tests I don't think my grandma can do. And so you think about, I don't think my uncle who had a stroke is going to be able to do, or my mother-in-law who had a heart attack. So there are other tests that mention, these are in the classification of functional performance assessment, but many of these tests are used in the battery test for older adults that are frail. So there's the 8-foot U-on-Go test, 6-minute walk test, 2-minute step test, 30-second chair stand test, 30-second arm curl test, and chair and sit and reach test. So let's take a look. So the 8-foot up and go test, you place a 7-inch high chair against a wall with a cone 8 feet away. You place it against the wall because when they come back, they may move it back. So you want to be up against the wall so that that doesn't happen. And if you click on that, you can watch the video. That'll help you to remember. So on a verbal go signal, the client has to get out of the chair and walk as quickly around the cone and back to the chair, returning to this, and then sit down. So you start the stopwatch on the go signal and stop once the client returns to the fully seated. So see how quickly get up and go. Some people just call it the get up and go test. After a practice trial, you administer 2 test trials and then record both times to the nearest 1/10 of a second. The faster of the 2 trials is recorded. So we're going to see how fast they are on the get up and go. And the standards for that test are in your textbook on table 216. Then we have the 6-minute walk test. And this test was designed to, it's a very popular test also to determine how well people are doing on the lifespan, how likely they are to live longer than estimated. So clients are instructed to walk around the perimeter of a 5-yard by 20 yards. So think about like a hallway. It was designed with a hospital hallway in mind, because you could do it on a hospital environment. So they're going to be walking for 6 minutes. So upon completion of the 6 minutes, clients are instructed to walk in place for 1 minute as the number of laps and partial laps is tabulated, and then total yards that they traveled are calculated. And there's standards for that test shown. So the more distance that you can travel, the better functional capacity you have, the better you are to get through your everyday life. So this is the 2-minute step test. It's not quite a step like a box step. It is more how many times you can move your knees up and down kind of test. You can watch the video on how to do this one. It's not too complicated. You're gonna first determine the minimum step height for each client. So you're gonna find the midway point between the patella and the iliac crest. So all the way up in the top part of the hip. So not like the skin fold, but all the way up at the top part of the hip bone. So you go from there to the middle, to the patella, the midpoint. You place a tape on the individual's leg to mark the spot. Then you have them lean over towards the wall. Either move the tape over or just put another mark or tape on the wall. You tell the client to go on the signal, so you start counting. The client begins stepping in place. You count the number of times that the right knee reaches the proper height. So each time the right knee touches, so if they don't quite make it, that doesn't count. So you can actually, to let the clients know, you go, so let's say they're doing it on 1, and then the next time they don't do it, you go 1. And so they know that they gotta go a little higher, so you only count when they get the knee to the marker. And so how many times they get that right knee up to the marker is the number that you're going to count. So not very difficult to do. Think about clients that have limited range of motion, so this test is made for them. And so think about clients that cannot step up on the box, like the 3-minute step test. So this may be a good alternative for those clients. Then we have the 30-second chair stand test. Again, another skill of functional ability for folks that have trouble getting through the everyday life. Realize that for some folks, getting out of a chair is our 1 rep max. They have to actually use their hands, they have to push themselves up and lean forward and use momentum to get themselves up. So although this test may seem easy, it could be very challenging for some. So again, you're going to place a chair that's securely against the wall, and instruct the client to sit in the middle of the chair with the back straight, feet flat on the floor, and then you're not going to have them cross their arms at their wrist. Right there, sometimes this is a limiting factor because they need their hands to be able to push off. So when you tell them to put their hands on their shoulders like this, that's it. So then you know. So you can modify the test if you need to, but record that. Okay, we're going to do it, and we're going to push off, but or any other modification. But you can't compare it to the table. Then you have to compare it to themselves. So on the signal go, the client rises to fully standing without using the hands, and then returns to fully seated. And so you can encourage the client to do as many times as they can in 30 seconds. And so you count how many times they actually completely get up. If they start to lose their balance or anything like that, or they're dizzy or they have pain, then you stop the test. If you do the test just like it's described, with the hands on their shoulders like it's shown, then you can use the standards. Okay, if not, just count that number and how they did it, and then next time you do it the same way, and then if at some point they think they can do it with their hands, then start counting from there. The 30-second arm curl test. So this is a nice substitution for any of the muscular endurance tests. A limitation for some could be that 5-pound dumbbell for some women. It may be it's not something they can do at all. They have arthritic joints. Sometimes it's just not possible, but it's a good alternative for those that could do it. 5 pounds for women, 8 pounds for men. Neutral grip, so on the side like she is shown on the video, and so have the client curl the arm into supinated position and then lower again as many times as possible in 30 seconds. So and make sure they're not swinging forward, so they're not using momentum or lifting with their shoulder. So make sure they keep the arm at the side. You may have to guide them initially so that they get the hang of it without swinging the weight and lifting the shoulder up. So you count as many repetitions as they can do, and then compare to the table if they did it like shown. And so another one that may be a substitute for the sit and reach test. Imagine getting an older adult who's really deconditioned on the ground. You may never be able to get them back up again, and they'll tell you this. So this one is to be done in a chair. So you make sure the chair is secured. In this video, he doesn't have it secure against the wall. That's the only thing, but he does a pretty good job of showing it. You have have the client sit on the edge of the chair with one leg flexed and one leg fully extended. So one leg is down for balance, and the other leg is extended. So they should have them inhale and have them exhale slowly while flexing forward at the waist towards the toes. Arms outstretched and hands overlapping, just like you do with the sit and reach on that we do for our general population. So they inhale and they exhale and try to see how far they go. If they extend it, then you ask them to be moved slowly back up until the knee is fully extended. So you record maximum distance reach and held for 2 seconds, and you just record that because it's depending on the client, right? So see how much they travel. It depends on their leg length and arm lengths as well. All right, so now that brings us to after we got all of this information. So now thinking about we have all their health histories, we've already screened them, we know about a lot more about who they are, and so now is the time to lay down some concrete motivators. And the motivators are their goals, and the goals have to come from what they want to do. Goals that come from what they want are going to be the most impactful goals, and that's what we want. So we may guide them in some of the deficiencies that we found that were revealed from the testing, and we want to make sure that we include some short, medium, and long-term goals. Short-term goals maybe every 4 to 5 weeks, maybe medium, maybe 5 to 6 months, long-term maybe a year to 2 years, so what they want to do. And again, if we can find the one thing that they really want to do, it's motivating to them, that they're going to put effort into, they're going to be excited about accomplishing, that's the kinds of goals that we want. So as far as the acronym of how do we write these goals, and they should be written out, not just said. Maybe they will be part of your contract agreement. They need to be specific. Say exactly what it is that you want to accomplish. Specific goals are things that you can observe and measure. So specific goals that are, and then you want to make sure that they're something you can measure. So saying, I want to be more flexible. Well, that's not very concrete. What more than what? So you have to write things out more specifically so that it can be something that you can measure. Usually action oriented. So action oriented goals are something again that you can see. Feeling better is not something you can see. So action oriented or something you can achieve. Something that is realistic for them. So a goal of, let's say, someone who's deconditioned and new to exercise. If I were to say a goal of you're gonna do aerobic exercise at 30 minutes, 4 times a week, at 70% of your heart rate reserve. Yeah, that's not a realistic goal, right? So it may be somewhat specific. It may be something you can measure, maybe something you can see, but it's not. It's going to be way too intense for a beginner. So not a realistic or maybe even relevant goal for this person. And then you always want to put a date at the end of the goal. You want to make sure that although we can tweak the dates, you want to make sure that it keeps you honest. So like if we were at UCF and we say, hey, you can finish whenever, you have all your life to finish, you may decide to take time off and you may never get anywhere. So you want to make sure there's dates associated with the goals. 7 practical principles of goal setting are really part of the process. So again, make sure that you're using the SMART acronym to write out your goals. Think about how much time it's going to take to accomplish the goals. So make sure the goals are accomplishable in the time that you have. And they need to be somewhat difficult, because if everybody could get a bachelor's degree and everybody can have them, then or if everybody can be part of that club, who wants to be part of that club, right? So you want goals that are moderately difficult but not impossible. So goals that are too easy, not motivating. Goals that are impossible, frustrating. So they have to be somewhere just about right, and so that's important. Always record the goals and then always monitor the progress to see how you're doing. And as a trainer, we go back to the goals and see how are we doing getting close to what our goal is, because that's motivating and that builds self-efficacy in individuals, and that's what makes a difference from someone who's motivated to succeed and accomplish and show up for sessions and someone who calls off all the time and never shows up. So when you start to see that, when you start to see lack of interest, go back to your goals. That's where the problem lies. Lastly, I think this is a repetition of what we said earlier, but make sure the goals come from a place of where the client wants, these are goals that they want to accomplish, not what someone else wants for them, not their spouse, not their children, not you, the trainer, but something that they find meaningful and important, and it's going to make them show up and spend time doing them. So how do we build motivation? Again, goal setting is the way. Goal setting and accomplishing goals is the way. But that's part of the adherence process. Someone who's not motivated is not motivated because they don't have goals and they don't have priorities. They don't know why they're there. You have to find out why. You have to find that. So goals that are motivating address 3 basic needs. There is competence. It's typically made when a person feels successful, so they have achieved some success. We do not like things that we fail at. So there is some success. We have programmed them for success. And when autonomy is met, it means when the person feels that the decision to participate is made without outside pressure or influence, meaning that it's something that they wanted. They're moved by something they want to accomplish, and it's something that it is very close to what they need and it's connected to them. So competence, autonomy, and relatedness should be part of the motivation process. And so lastly, some questions here if you stayed with the whole thing, and I'm going to give you the answers. Think about this as we do them. So during graded exercise testing, why are ramp protocols preferred to standard protocols such as the BRUCE protocol for the measurement of cardiovascular endurance in individuals with chronic disease. So why do we need to modify the Bruce protocol? Think about that. Is it because they include smaller changes in intensity? Is it because they are superior for detecting the presence of ischemic heart disease? Is it because they bring the individual to maximal exercise capacity more quickly? Is it because they allow more time for the measurement of blood pressure? Right? So if you were thinking A, they include smaller changes in intensity, you would be correct. And again, there's various variations, RAM protocols, that may be better suited for individuals with chronic disease. So if you have the equipment available, you could modify some of the Bruce protocol to be doable for those with chronic disease. Which of the following provides the most direct measurement of percent body fat? Skin fold testing, body mass index, waist to hip girth ratio, or body weight? So the only one there that actually gives you body fat would be skin fold testing. So body mass index does not, waist to hip ratio does not. Both of the BMI and waist to hip let you know about health status, but they don't tell you body fat percentage. And certainly body weight is just your weight, does not say anything about body fatness. Number 3, which of the following is an appropriate part of the procedure for obtaining an accurate sit and reach flexibility measurement? And this is true for any flexibility measurement. The client should warm up for 3 to 5 minutes with light exercise. Let's see, the client must hold the stretch for 7 seconds. The client should inhale while holding the stretch. So after you fall forward, you should hold your breath and inhale. The exercise professional should use a 3rd trial as the final score. Well, if you were thinking A, that you should warm up before any kind of flexibility test, you would be correct. And as we said earlier, if you've done the cardiovascular testing first, then you're already warmed up. That's about 3 to 5 minutes. But if not, if you're going to do flexibility first, maybe after non-fatiguing test, then you should do a warm-up first. 7 seconds is way too long to hold the stretch, and the client actually should exhale when they're going forward. And you do not use the 3rd trial, you use the best trial, the best score for your sit and reach testing. Right, which of the following tests may be an appropriate substitute for the sit and reach test for an older adult? So we have the 30-second arm curl test. That's with the dumbbell, 5 pounds for women, 8 pounds for men, and for 30 seconds. Doesn't sound like that would be flexibility. Chair sit and reach test. 2-minute step test. That one is more about how many times you can lift your knee to a certain mark, your right knee to a certain marker. Or the 8-foot up and go test. Right, that one is more how nimble you are, how quick you can get up and go. The one that makes the most sense would be, if you were thinking it, chair sit and reach test, and that would be correct. Okay, if you have watched the presentation or listened to the presentation and you have read your chapter 2, second part, you are ready then to take fitness assessment quiz. Thank you. I will talk to you guys soon.